put up the fight. Good morning and welcome to This Week.
The motion is agreed to.
60 votes and the debate begins.
Doing nothing is not an option.
These bills don't reform health care. What they do is grow government.
But are there 60 Senate votes to pass reform? Can there be agreement with the House?
Bernie Madoff went to jail for this kind of behavior.
I have no doubt we will pass this bill.
And are those controversial new cancer guidelines the future of health care?
This is how rationing began.
This is an independent task force. It's not the government.
Those questions this morning to 4 key players from the Senate and the House are This Week debate. Then, as the president tours Asia, Sarah Palin tours the country. That and the rest of the week's politics on our roundtable with George Will, Robert Reich of the American Prospect, Republican strategist Liz Cheney, and best-selling biographer Walter Isaacson of the Aspen Institute. And, as always, the Sunday Funnies.
They're having a big Thanksgiving dinner at Sarah Palin's house, and people say, well, is she a good cook? And I said, well, sure, she cooked John McCain's goose.
Whoa!
From the heart of the nation's capital, This Week, with ABC News Chief Washington Correspondent George Stephanopoulos, live from the Newseum on Pennsylvania Avenue.
Both sides called it historic, but while Republicans insisted that yesterday's vote to break a filibuster is the decisive vote on health reform, several Democrats said there was nothing final about it, simply a vote to begin the debate. And let me begin our debate this morning by bringing in our panel. I am joined by Congresswoman Marsha Blackburn of Tennessee, Republican of Tennessee, Senator Tom Coburn, Republican of Oklahoma, Senator Ben Nelson, Democrat of Nebraska, and Congresswoman Debbie Wasserman Schultz, Democrat of Florida. And Senator Nelson, let me begin with you on this overall question. You heard Senator McConnell, several other Republicans yesterday saying this is the vote. And a couple of weeks ago, you seemed to agree. You were talking to our John Carlin. You said if you couldn't live with the bill, then you wouldn't vote to let the debate begin. So does that mean that you can live with this bill?
No. What I meant by that is that if I thought the bill couldn't, this was before I saw the bill, but if I thought the bill couldn't be amended and couldn't be corrected and improved, then I wouldn't vote to move it forward and move the debate. But when I saw the bill, I said this can be amended, it can be improved, and the debate should begin, and we ought not to stop the opportunity to improve the bill when it could be.
But to be clear, if there were a vote to end the debate today, you would not vote to end the debate?
I would have voted no. I would have voted no. I would have voted to end, not to end debate. I would have voted no on a cloture vote to end debate.
So you wouldn't let it get off the floor?
So I would not let it get off the floor. That's what that means. That's the next round.
Senator Coburn, you also promised before the vote yesterday to read all 2,000 pages, yet you didn't do it. Is that a sign to you that just the handwriting's on the wall and you decided to fold?
Well, it didn't accomplish a purpose. What we're going to do is read the bill to the American public. I think what you'll be seeing when we come back is us going through it section by section, explaining what it means. It was a symbolic gesture, but it didn't work with what Senator Reid and Senator McConnell wanted to do. Understand that. I don't think we lose anything in the debate, but the important thing is for the American people to understand that this bill doesn't fix what's wrong with health care. We're treating symptoms, not the disease. And it's really malpractice what we're doing. The problem in America today with health care is it costs too much, George. And there's nothing to address that. And 1 out of every $3 that Americans spend today doesn't help anybody get well and doesn't keep anybody from getting sick. So why would we not want to go and fix the problems in health care, not the symptoms that all the politicians play around with, but the real problems?
I want to get to Congresswoman, but first let me just answer that one point. He says it doesn't do anything to control the cost.
Well, it doesn't do enough to control the cost, that's for sure. And we do need to address that cost containment. I'm very concerned about that. But I certainly couldn't say it does nothing. I think the effort on prevention, early detection, wellness, the workforce development for more primary care physicians, those will all be helpful in reducing the cost of health care.
And ask the question, George, why do we have an imbalance in primary care physicians? Why is it there? Does anybody know? It's because we pay them 300% lower than we pay the subspecialists. And so we don't do anything in that. We're going to help pay for some of their education, but we do nothing to change that balance. 1 in 50 doctors graduating last year decided to go into primary care. That's a disaster that has been caused by Medicare setting the prices.
So not enough for primary care, although, as you point out, there are more incentives for primary care education in this. But I want to bring the question to you, Congresswoman, is the differences between the House and the Senate bill. Some fairly significant differences over how to pay for the bill, over how abortion services are covered on size, $1 trillion or so for the House bill, below $900 on the Senate bill, and of course on this public option. So when you look at what the Senate is considering now, is that something you and the majority of Democrats in the House can go for?
Well, what's important to focus on, George, is that there's far more that we have in common between the two bills than our differences. And while some of the differences are significant, all Democrats, whether it's a Senate Democrat or a House Democrat, are committed to health care reform and making sure that we can cover the people in America who are uninsured. About 31 or 36 million individuals are covered by both of these bills. Make sure we can provide security and stability to those who don't have health insurance, and that's been really under-examined. We have, about 85% of the Americans who have coverage, and every year, whether you're a small business owner or an individual, they have skyrocketing insurance premiums that this bill will get a handle on both bills, and making sure that we can bring down and control costs. And with all due respect, Senator Coburn, both of these bills will bring down costs and control